This is from Music Bum. I like that. I'm really worried about taking hormone pills. Half dose, but if it doesn't improve, the dose will increase. Well, the problem, without me even going any further, is if you take them, your body quits making them. So you see an improvement short term, and then you see the other side of that. Because your gland is going to keep getting weaker and weaker and weaker. And of course the dosages will go up and up and up. But the problem is multiple, because you're suppressing a whole gland which does many other things besides generally the hormone or steroid you're taking. So that's the inappropriate way to be healthy, is to taking hormones or steroids. Matter of fact, another insane concept by the allopathic community, but I'll be honest, I can't just blame them. A lot of naturopaths are doing it. And it's like, oh my God. We've just, you know, some lady was in here from YouTube the other day, and she's a real smart lady, and she wanted to get, she was already an acupuncturist or something. She wanted to become a naturopath. I said, why bother? You know, become an herbalist, because naturopaths have rubbed naturopathy in the ground. You know, I understand a lot of people that become naturopaths are sincere and really want to help people, but naturopathy is a system not taught in this country. This is why I went to England. But there have been some schools that have skirted around it. But it wasn't just me. Dr. Jensen, you know, Bastyr and Southwest are two schools. Always tried to get Jensen on the board. I told you about that. And there's no way. And I couldn't, and I wasn't going to even slightly talk him into it, because they didn't follow the principles that we do in naturopathy. And I'm steadfast on those. You don't treat symptoms. States don't like it. Medical doctors don't like it. And I personally don't like it, because you know, not the medical doctors have all their diseases. But when you're thinking of symptomology, you want to think of causology. Oh, excuse me. See, I'm getting it up too, guys, and I'm happy. So you know, I go through my stuff. So you guys can feel comfortable. The old man's going through it too. My doctor is prescribing to boost my estrogen. I turned, oh honey, no. If you want to boost your estrogen, work on two things. If it's ovarian estrogen, you're going to deal with pituitary problems more than likely, but take the female reproductive formula. It strengthens the ovaries as well. If you're going to go look at your systemic estrogen, you want a clean liver and you want a great adrenal gland. Bottom line, because you want its sidekick progesterone just as balanced. I'm telling you, you don't want more estrogen than you can deal with. Matter of fact, the problem today is most women are estrogenic. They're too much estrogen and progesterone levels are low. And that's the opposite of really what you want. She's turned 17 at the weekend, yet happy birthday there. Yet I've not had my period since November 2010. Get on that pituitary gland, honey. Start on the female reproductive formula. It should start it straight away, or pretty close, and work on your pituitary gland. Don't start taking estrogen. Not smart. I started my period February '09, though. The doctor says to start my period again. For everything else to regulate, I will need to gain weight. Okay, that was a real smart opinion. I've been the same weight before and during not having my period. I was born premature and seemed slim my entire life. Well, look at malabsorption, look at the pancreas, and so you're digesting. Look at those two factions and fix them up, honey, and you'll get your weight back on there in a good way, muscle way. But this is a pituitary problem, if you ask me, looking at this scenario here. My BMI obviously is very low at 15. Also, I had a blood test which showed that my hormone levels were as follows. LHO1 and FSH 1.8. Now, you know what? You're going to get up to the pituitary. That's where these are, and this is where you need to be, is in your pituitary. Try the female reproductive formula. Another thing is, maybe get a picture of your eyes, take a look, see if you have, remember the transverse bowel totally relates to this. So you want to clean up your GI tract. You can take a glandular for the pituitary, but try the female reproductive formula first, and see if you can strengthen all that up and just start getting your period again. I've never seen too many people that couldn't. Matter of fact, I don't know if we've ever had one that couldn't. What is the cause? Stress, lack of sleep? No. Genetics. You're 17. I turned vegetarian 3 months ago, and my parents really didn't like this. Small change. So I have no idea how I could become raw or do detox. Well, you know what? At 17, your parents have to get on board and understand this. Let them review these videos. Let them get savvy so they know they can get their health, because you're a genetic print of those two. So one of those two have some pituitary problems, guaranteed, and colon problems, guaranteed. Guaranteed. My doctor's basically worried I have developed osteoporosis at a young age. You know, forget this estrogen and osteoporosis crap. This is crap, crap, crap. Estrogen is acidic, has nothing to do with calcium utilization. If anything, estrogen will ravish the body from calcium. So be real careful with the medical doctor's thinking with estrogen and calcium. That's bull crap. Parathyroid. Now, could you have a parathyroid weakness because of the pituitary gland? Absolutely. That's PTH. And then you got a TSH, thyroid stimulating hormone. You got a lot going on up there, honey. So really, just start going after your health issues. You want to put on muscle anyway. And if you're too thin, you're malabsorbed, that goes back to the bowels again. So now you're at the GI tract, lymphatically speaking. Now the GI tract, of course, controls the pituitary, so you're there as well. So go in that way and work on those things, and you'll pull yourself out of this a lot better than going this other route of thinking. Besides, blood work hormones and steroids are very inaccurate. Should I go for the pills, which are obviously an artificial copy? No, I think you should address the cause of the factor. On the side note, I was born with colorectal back to the bowels again, colorectal complications, and I've had 9 surgeries, and I've had my tonsils removed as well as my appendix tampered with for an ACE procedure. Well, that speaks right where you have your problems. You're right there. And that's where you have your problems, sweetheart. Start getting yourself healthy. Get on these herbs, get the stomach and bowel herbs, get the female reproductive, work on that. Clean out your lymph system. You're a genetic print, sweetheart. And I've been saying this about the young folks like yourself. You guys have got some work to do to back up your health issues and get healthy again. Parents did not know. Parents don't think about health. We live in a society, you go along, you eat mama's cooking, and that's the way it is. Well, there's a renaissance happening here that you must wake up to have a good life, and you're only 17, honey, so get your health together. I'll show you how to straighten all this around. You'll do it properly with healthy glands, and then when you have your child or children, they'll be healthy too, or you're going to keep getting down this never-ending story to where your line will end. So don't go there. How many days until I could see some results? Hunter Lester. Someone talking to you, I guess. Everybody wants to know time factors. It's like, forget about time. That's our problem. We don't care about time. If you're living in the world of time, you're living in the world of the mind. And if you're living in the world of the mind, you're not free. You're a slave. And you're not being who you really are. And you're not enjoying the ecstasy of the great and of the expanded, and of awareness. You're being driven by thought and emotions. Anyone have a suggestion as to what to put the herbs? The taste is killing me. All of my love to you. Grape juice. It's the only one. It's the only one. Grape juice. And if you don't like it in grape juice, that... Hold your nose, tongue, and chase it. Do it quick. A little water, gulp it, and then chase it. But put it on some food. Does anyone know when the best time to take the capsules that Dr. Morse recommends? You know what? I don't care if you take them all with your foods. It'd be nice to take your bowel formulas. If you're on number one, there's nothing to move you anyway. If you're a little sluggish moving, you could separate the bowel capsules maybe a half hour from your food or something, but everything else down the hatch. Everybody's conscious. Everybody knows where they're going. Morning, noon, and night are the 3 times, CB. Morning, noon, and night. If you get them in twice a day, I'm happy. If you want to go aggressive, do 3 times. We do 3 times a day here. But for me, you can do twice a day, that's fine. But do a whole dropper full at least if you're only doing it twice a day or a little more. I tend to do a little more when I'm doing them because, you know, you got 5, 6 herbs in each formula. So you're just, you don't have that much in a dropper full. If you got 5 herbs in a dropper full, you only have about that much for each herb in there. So it's not something to worry about. Dr. Morse, fruit pollen syndrome, or oral allergy syndrome. Dr. Morris, greetings, my friend. Greetings to you, my friend. I was trying to help my sister and her family with general health and getting into juicing and raw foods. She told me they're into it, but their daughter, who is 12, actually has fruit pollen sensitive syndrome, or oral allergy syndrome, which basically is an allergy reaction to some fruits and veggies and makes her mouth itch and burn. Well, that's scary. You know why that's scary? How acidic is your little 12-year-old girl? This is serious. She's not going to have good teeth, and she's not going to have good jawbones. I mean, this is serious stuff. You want to get this little girl's lymph system moving ASAP, get her kidneys up, but she's 12 years old. She's going to have serious kidney and adrenal problems. And remember, it just goes with it. Even if you were off, you still want to go there. Doesn't matter. You're going right to the heart of these issues. And so, absolutely, this poor thing is way too acidic. You want to move that lymph. So whatever you move her through to move that lymph, you get her mouth cleaned out, use a heel oil tea, make it real light, and have her soak her mouth. Take some more, soak her mouth, start getting apples then, get grapes maybe, and really fix. She's going to have some lymphatic problems. Detox is totally full of symptoms. Detox is not a symptom-free program, a symptom-free focus. Some people go through pure hell detoxing, no question about it. I've had my hell at times detoxifying. Generally, it's just the mucus and congestion from eating foods that stimulate. If I do cayenne pepper, I'll get a lot of mucus from it. It doesn't break up my mucus. It causes a lot of mucus because my mucosa is sensitive. It doesn't like abrasive foods. And that includes onions and garlic. I can eat onions now. But still, that's a little rough on me. There was a day I couldn't touch anything like that. And I used to eat them like crazy growing up, except garlic. We weren't garlic people. We were farmers. We never really got into garlic.